I was sitting there at, the villa with the policymakers, the governors, and Mr. President. And I had to do a clip, quick, which was played back, so that governors themselves can go back and become themselves ambassadors to promote polio eradication in Nigeria. Wow. That's the work of the media. You remember the facility we saw that was pre-independence, but today they've been upgraded, and if you go there, the life of the community has actually changed. Why? Because media came.
Welcome to another episode and interesting edition of the Curated Conversations by Nigeria Health Watch. This is essentially where we sit down with experts, policymakers, policy advocates who are making change, who are working in Nigeria's health sector and asking the simple question: what is happening? What are we doing? What needs to change? What is not working? And what do we need to make the health system work better for you and I? And on today's episode, we have a very interesting guest. Really honored to be the one sitting down with her. We fondly call her Auntie Moji, and I think I will stick to that throughout the conversation. Thank you so much for the opportunity to interview you today, have you on the show. So she is formally, so I will do formal. She is formal. We call her Chief Mrs. Moji Makanjuola, MFR and FNIPR. I'll explain that later. She is Executive Director and founder of the International Society of Media in Public Health. What that means essentially is she leads a very dynamic and media-driven coalition committed to ensuring that public health equity and accountability really across Nigeria is working for all of us. So how do we use all of those tools? Media as a very important strategy to advance public health. But importantly, why she's a veteran and someone who is well known and respected in this space is she's a pioneering broadcast journalist and also the former head of the Health and Gender Desk at Nigeria Television Authority. I'm sure a lot of us, grew up watching NTA, waiting for that 4 p.m. multicolored bars for the programs to start. So it's really a pleasure to have those who really made those things happen to be sitting down today with you. She's also widely recognized as Nigeria's first female international health correspondent. Really a lot of accolades. Thank you so much for all the amazing work you've done. And in addition to all of this, she also has other roles and responsibilities that she's engaged with in the society. For example, being the national president of the Nigerian Association of Women Journalists, and also recently inducted as a fellow of the Nigerian Institute of Public Relations. So that's the NIPR that I talked about earlier. So it's really a pleasure to have you.
Thank you. Pleasure is mine as well. Thank you for inviting me.
And again, so I forgot to mention this. Congratulations to on celebrating your 70th birthday.
Thank you.
So how does it feel, being able to contribute and do this work consistently for over six decades now?
Yeah. I feel good. I feel extremely fulfilled that what we started as an experiment on NTA has become the norm in most media houses today. A lot of health desks have emerged, have evolved, and they are thriving. We have a conglomerate of people who proudly call themselves health correspondents. It's a beat that has been recognized as part of the strategic development tool for the country, particularly in the health sector. So for me, that's fulfillment. And the fact that in our own climb here in Nigeria, we need information, good information.
Absolutely.
And the health correspondent or the health desk has been able to come alive and get this done. So I'm happy, I'm pleased, I'm proud.
Yeah, and really, looking back to see how you contributed to all of that, building and training people. But we'll get back to that. So again, we start from there, where all of this started, because you've definitely had a remarkable career in journalism, media, public health advocacy, actually becoming one of the leading voices as far as connecting media and health is concerned in Nigeria. So looking back at how all of this started, your whole journey, were there personal experiences or defining moments that first shaped your interest in storytelling, public health communication, and eventually public health advocacy, which you do very well now?
Yes. There were defining moments. There was a particular defining moment. I lost my mother to a road accident, and she was ignored because she didn't have, exterior wounds. There was no fracture visible and all that. So eventually when a rescue came, they took her to the hospital, and at that time, I think the emergency response was not quite there, and I believe that maybe if that was there, she probably would have lived, because what she had then was internal hemorrhage. So she was bleeding inside, but because we don't have all that equipment that can actually, when they take you to an emergency unit, all this can quickly be identified, and some measure of response and rescue can come in. So I lost her. She was my friend. She was 49, and we were planning for her 50th birthday. And because she was such an introvert, home, her shop, and church, we wanted to give her a bash. And so it was all planned, and she passed on. But my coming alive with, the gaps that existed at that point when she needed treatment. Yes, they had people. And as I read and researched into some of the things that could have been done, so it showed me the huge gap that existed in the health sector. And so each time I was asked to go report health, it became a passion. And if I was to speak, as young as I was then, I was crying out loud to please equip our tertiary institutions. So for me, it's from the agony of losing my mother and being able to use my pen and my microphone and of course the camera to speak out loud to the fact that, we need to change the dynamics of services that were available, particularly at the tertiary institutions at that time. So I got involved. I got a push by my boss, who said to me that, okay, Moji, this is your passion. I didn't want to be stereotyped, with the gender desk to report women. And at that time, what we did report was, fashion, cocaine. And for me, they were two, these were things that we get to do every day. I wanted developmental issues to speak to, and the health desk provided that opportunity for me. And then she gave me a go-ahead by, even as junior as I was, to make me the first head of health and gender desk.
Wow, that's really it is actually the first time I'm hearing this story. So stressing how those personal experiences shape the trajectory of careers and decisions we make. And I'm glad that you made the most out of that, like you said, from agony to now leading something that became quite profound. But just quick, just throw in a quick one, just how, looking back from that time to those issues that poured you to, started crying out and pushing for those things, and where we are now, how would you assess the situation of things then and now, and still being in that space?
Chibuike, if you asked me this maybe 7-8 years back, I would say to you, no, let's look at 15 years back. I would say, yes, things have changed in the sense that, there was a political will to make tertiary health institutions centers of excellence, because there's nowhere you go in the world, there's no practice in medicine, any specialization that you don't find in Nigeria. very qualified.
Right.
And when you ask, they say because there are no facilities or equipment or general environment for them to be able to thrive back home. During the Obasanjo administration, that was a concerted effort to change that dynamics and bring in the fact that we can treat, we can do things here. And I would have thought that from there we would have moved on higher. We should be doing robotics now. We should be doing all the new things that have happened, particularly at the tertiary level. Unfortunately, we're not there. And these are some of the times that, I get very emotional about the advantages, about the opportunities as a country that we have in terms of human resources. But things are changing now because you have some of these specialist hospitals, coming up. And so that's for tertiary institutions.
Right.
For primary health care, I was fortunate to also be, as a core reporter, to go on the field with late Ransom Kuti. And I knew what we're able to, this country achieved with immunization. Let's take immunization, for example. He went to the field, he spoke to the people, he met the people. And so even as a reporter then, you don't have a choice. You go beyond, the call of duty. Because here's him saying to us, the advantages of immunization. And so at that time, the statistic showed that immunization, galloped up.
Yeah.
Which then, gave some measure of hope to stem the tide of childhood killer diseases. Then we went down again. But again, we're rising on it. Then we had polio. Seen a child, and that child in 2-3 weeks, losing the use of the limbs, and it's permanent. And this could have been avoided. Yeah. It's preventable. So these are moments that, we've had, some, back and forth. But I think now, with the reforms, we're more focused as a country.
Right.
This is what we need. This is where we're going.
Thanks for sharing that. So basically, it's a lot of ups and downs, but the most important thing is that we are moving, right? We're not, stagnant. So coming back to the present and the work you do at the International Society for Media in Public Health, where you consistently have advocated for stronger collaboration between media and public health institutions and leaders, particularly in shaping how people understand all of these health issues that we talk about. So how would you, working across both fields now, as in the journalism space, but also in the public health space, because pretty much everyone in that space knows who you are and work with you. What do you think are some of the biggest gaps as far as health reporting and public health communication? What are the
the biggest gaps that I have witnessed? First is limited knowledge. Those are gaps that then you had to like school yourself, but so the gaps they still exist.
Right.
And I keep telling my colleagues that if you want to be a health correspondent, then you must move from being an event correspondent to health correspondent. And how do you get that? You need to educate yourself. You seek knowledge. And the religions that we all, love in Nigeria, both adhere to the fact that, speak to the fact that you need to seek knowledge. You need to know more than you just go and report. A lot of us are not quite conversant. We just come health correspondent. I've heard somebody said to me, I want to be known like Moji Makanjuola. And I say, it's hard work,
Right.
and which earned me, a fellowship with the CDC Atlanta to go and read public health, hands-on, So that's number one. Number two is trust. It depends on, who is driving the vehicle for health.
Right.
Because we are so dependent on public health institutions or public health policies, which is governed and dished out by government, what affects lack of trust that affects government affects you, because you go report on a certain reform and people get back to you that don't be like them,
Right.
You must carve your niche, speak the truth to power. And that's what health is saying. You cannot conjure things that don't happen. If there's an epidemic, there's an epidemic. Go about it, find out, read, encourage yourselves to know, so that you can report from the point of knowledge. Oftentimes, as journalists, particularly what I see these days, we're too lazy. So we are not self-educating. We are not self-seeking. But some of us are doing very well.
Right.
And I'd like to use this platform to commend those who have done very, very well. So, but there are still gaps in the sense, and thank God for, what you're doing in Health Watch, reaching out, building capacity and all that, which we have a commonality in. But most importantly is your self-will. Look, there are other beats will give you much more in terms of opportunities and all that. But health beat is about humanity.
Right.
So you need to school yourself and make up your mind that I'm going to be one person that's going to contribute to improving health sector in Nigeria. Why? About close to 70% of what we have that disturbs us, as and brings down the health indicators, are preventable. And you can use your medium, or you can use the skills that you have as a journalist to help reduce these high incidences. Promote immunization. It's beyond the call of duty.
Right.
Speak to experts. These days, by now, we should have a compendium of who to go to. Those days we used to, subscribe to journals, because then you didn't have the world on your palm.
Right.
So I guess that the gaps that are there today is education. Not just classroom educations, but, things that you can acquire yourself. You should track events. We don't track events. Let's use the NCDC that keeps us on alert of, diseases, outbreaks and all that. Do you know, at the beginning of COVID, Nigerian journalists were, taken aback. Then a lot of fright came in, and at some point we were complaining that nobody's looking after the journalists. I believe the journalists should be in the forefront to look after, because you have to go get news and get people educated. So I remember that I had to send gloves to my colleagues,
Wow.
from where I was. So go cover, so that people would know this epidemic or pandemic, as it became, is something that needs a lot of information and education out there. So the gaps are there. And I want to use this platform also to appeal to universities, to create even short-time certified courses for people who are really interested in reporting health. Because if we can prevent 60 to 70% of all these deaths, then we can also, use more energy to also look at non-communicable diseases. Because for us in this country, it's double tragedy.
Right.
The high incidences of maternal and child mortality, things that could be prevented. Then now we have non-communicable diseases to deal with. The cancers of this world, the
Right.
hypertension of this world, the obesity, and name it. And these are areas where us, media practitioners, as health correspondents, should be so learned in, so that you can speak, you speak with some measure of authority.
Yeah.
Know who to go to. You will have the resource persons that, believability becomes your own toga. Because, if you listen to Health Watch, the truth is coming out. If you, or go to ISMPH page, you will get that done. So we need to close these gaps, like yesterday. If the reforms are there, we need to be alive with the reforms, so that we can properly educate Nigerians, so that we can create demand. Health sector is one place where outside strikes,
Yeah.
No demands are made in terms of infrastructural development or bad road or education or the fact that services are poor and all that. But thank God, these things are beginning to, to be part of the current reform. So
Right.
plenty of work.
Thanks so much for clearly illustrating that, because that's in between, right? Between from reporting, just regular health journalism, like you said, events and whatnot, and public understanding. So that's health communication, people understanding is knowledge. So you understand, you're able to translate better so people can engage, and like ended with demand for better health care. So it's not just from reporting event. And it's interesting you mentioned that, because this is actually something I know you've been advocating for. So my early foray into health journalism, when I joined Nigeria Health Watch 2018, one of the earliest workshops that I attended, you were part of it. I think it was hosted somewhere in Kefi. Remember, it's with Abt Associates. So you were there, you spoke, and we went to a community afterwards.
And Chibuike, look, I'm so fulfilled. That community has changed today. You remember the facility we saw that was pre-independence, but today they've been upgraded and steady. We still have nurses and doctors visit them, and if you go there, the life of the community has actually changed.
Interesting.
Why? Because media came.
Yep. And surface those issues, because I remember one of the things you also emphasized there was knowledge. Like you said, encourage colleagues to learn, upgrade themselves, and thanks for consistently saying that. So I'm hoping that we are listening and we are going to act with the information.
I pray so.
So again, over the years, Nigeria, of course, other countries across the continent, we've been dealing with several public health issues: maternal health, poor maternal health outcomes, disease outbreaks, and like I said earlier, you work in both spaces: public health advocacy, policy advocacy, but also leveraging the media as a tool, to drive those conversations and change. So in terms of lessons now, you've talked about challenges and what needs to change, but in terms of lessons, what have you learned over that time as far as influencing behavior, policy conversations, and also building trust in health systems, particularly in times of crisis?
I think what I've learned most is that if you are consistent with what you do, believability would grow. Your integrity as a health correspondent also will grow. And that is important. Very, very important, I'll emphasize. I would say also that it has also now been established that media is needed, is a strategic tool in the health, particularly in public health space.
Right.
Because a lot of things, a lot of interventions, a lot of innovations that have come, without the media would be like, we are blinking in the dark, speaking to ourselves, who know. And we are able to break down a lot of jargons. With doctors and medical practitioners, they have all their long names and long jargons. But we need to break it down for people to understand. The messaging, health messaging, has changed over the years. And so for me, it's a fulfillment of the fact that I chose a path that is saving lives. And it's not about Moji, it's about what is needed in our society. And I would also always say that we speak the language of the people. So the people, there's ownership in any intervention.
Right.
Because if you go to them and you're speaking like a professor would be speaking to his PhD class, then you won't go far. But if you go with the training that we have as journalists and media practitioners, people tend to accept and, be part of the drive to either contain or curtail or, stop an epidemic.
Right.
Let me give an example. During the polio eradication initiative, the media in Nigeria was divided. Those who were for the continuation of the polio vaccine use, and some who had their camp with some of the detractors, I'll call them detractors, or government detractors, who, because of their own personal gain, thought that, we should stop vaccinating children until we went round to find out the efficacy of the vaccine. Whilst that happened, where some states stopped, government now thought that let's go and do a fact finding. Initially, it was, biased to religion. So I was one of the, member of the team who visited South Africa, where same vaccines were used, and one of the most respected labs in the world, to find out whether it's the same vaccine that we used. We were in Indonesia, that housed, the most Muslims outside Saudi Arabia. We were in India, where the lab, where the vaccines were taken for tests. We were in 4 countries. And for everywhere we went, we had to be sure. I needed to go read about vaccine production.
Right.
Because that's not my turf. I needed to ask questions from, people that we meet along the way who are professionals. Tell me, how does these go from here to here? These vaccines, these little vials, how does it work with the body immunity, with what is needed to save the children from coming down with polio? And so for me, it became more for me a duty to speak to what I saw. So much so that, the head of state at that time, when we got back from this tour, asked that I should please do a summary. That's the president of Nigeria. Give us a summary of your take on these findings. And so again, shows that the media has become the strategic tool.
True.
And so I was sitting there at, the villa, with the policymakers, the governors, and Mr. President. And I had to do a clip, quick, which was played back, so that governors themselves can go back and become themselves ambassadors to promote polio eradication in Nigeria.
Wow. That's
the work of the media. And one of them became head of state. May his soul rest in peace. And that's one of the respects I have for him, late Yaradua. By the time he got to know of all the things we had done, he was governor then in Katsina, and he challenged all the political office holders, go deliver your word. Every child must be immunized against polio.
Interesting.
And for me, those are moments in my life that you cannot now convince me to say media has no place.
Of course.
So the media is an integral part of health development anywhere today. And the world has become a global village. So,
thanks so much. It was interesting, the context of, because the statement, go deliver your word, in Nigerian context, we associate it with, politics. You have to deliver your word. So it was interesting when you said the head of state said that, and usually in that context, deliver your...
Yeah, Governor Yaradua then, as governor of Katsina State, bless his soul.
Interesting.
Yes. Gave that order. It was an executive order. And it changed the trajectory for polio eradication in Katsina State.
Thanks so much for sharing that. So again, just, peeling it back a bit, what you just said about the media as an institution being integral in driving policy conversation, especially at that level, right? One of the tools that they use is storytelling, which again, illustrated in the example you gave, putting all of that in a report in a compelling way. And this is something that you've been at the forefront of, through your work at the ISMPH, building the capacity or strengthening the capacity, also mentoring journalists and media professionals on how to report these health issues more responsibly, but also effectively. So in terms of that being a tool, storytelling, what are you seeing in terms of lessons on how it is helping to shape public perception, but also, again, policy conversation, but maybe not at that higher level, just, like
but at every level is important, because whatever you say, you cascade it, it's needed to be cascaded to, to the subnationals to get it work. I would say the lessons learned is that I'll go back to my colleagues. You should strive to track development as it happens. Because if you lose sight of any policy intervention or any, those days, donor intervention, you might lose sight of, of the meat of the story. Before you know it, you now become event journalists, not a health correspondent who should be able to decipher quickly those news that are needed, for human survival. And I also think that going forward, for us as we have a peculiar situation in our country, and oftentimes you need to engage with the people. And when you engage with people, you let the world know. And that's what has evolved into engagement with traditional rulers, religious rulers, women groups, youth groups, who themselves take up, the duty of seeing themselves as ambassadors for improved healthcare delivery service in Nigeria. And look at what has happened today. Even the committee of non-state actors have been so revived and dynamic, like we have Health Watch. I mean, I was in Rwanda for a meeting and somebody was asking me, "Oh, do you know Health Watch?" I said, "Of course, yes, I know Health Watch." Oh, yeah. And that for me is, going beyond borders, because diseases don't have borders.
Right.
So if you have information and you don't know how to pass the information, we're sitting and blinking in the dark. I want to use a particular disease that, that is peculiar to the black race. Sickle cell disease. The first intervention, because it's a black man disease, nobody pays attention to it. But in Nigeria, at the National Institute of Drugs, is NIPR, so NIPRID?
NIPRID, yeah.
NIPRID discovered the use of local herbs that was providing succor for sickle cell anemia patients. Nobody was going to talk about it. We did a storytelling kind of documentary on it. And bless his soul, I mean, Professor Wambebe was then Director General of NIPRID. Look, he flew at that time when in Lagos, he flew all the way to Lagos just to say thank you. So we change the dynamics of things, but we need to, to say this from the point of knowledge. Because we spoke about, the media now took it up. We now had a field visit to NIPRID then from Lagos. So people knew that it existed.
Right.
And so much so that it brought, some measure of global attention for wanting to patent, the medication. Right. Beyond that, when policies are made, the first question you asked me, which I was, is where were we before? Wow. And where are we now? We should be able to do some measure of comparative analysis that gives us the true picture of what is happening. So I would say that we're not there yet.
Of course.
But we are getting.
Thank you so much.
We are getting better.
Thanks. So thanks. This has been really insightful. So we're going to wrap it up with the final question. Again, going back to you. So we've started from you, talked about the work and the whole ecosystem. So just going back again to, your, after all this, and of course still ongoing, decades of pioneering work at the intersection of media, public health. So when you reflect, right, when you go back to the impact that you've made through your career, the work that ISMPH is doing, the legacy that ISMPH will leave behind, what are your hopes, right, for the next generation of African journalists, public health advocates who are working to shape more informed, healthier, and at the end of the day, more equitable system or society?
Immediately, I would say that we still need more educated journalists, committed journalists to get the job going. we cannot stop, because life is all about health, and it is only a healthy herd of people that can accelerate development.
Right.
So we have a place in national development, and we must be convinced that we are not just any press person. We are special breed, to accelerate development in the country. 2, I would expect more capacity building. I would ask for self-education and your commitment to make a difference. And I would want people to be brave and courageous. You can't lie when people are dying from a particular thing. Then there are several apparatus now that you can use to do your research. People are lazy about research. I read NCDC every day, so that if I'm caught like you invited me here, I'll be abreast of what is happening. We don't track, we don't do follow-ups, and that's a big gap. We don't do follow-ups. We need to do follow-ups. Conclude a circle of story. Know how the health institution operates. So if a politician comes to your community and is promising hospital, you need to ask, who would man the hospital? What are you doing for the doctors to attract them to that level, to the sub-national level? How would you get medication? Sir, this hospital that you are promising, how would we get there? You recalled when we went to Rogua, it took us 3 hours to get there. Now it will take you less than 20 minutes.
Wow.
Yeah, because there was a multi-ask in terms of not just the facility, but how to get to facility. So a whole lot of gamut needs for us as journalists to address. And it's doable, it's actionable, it depends on you.
Absolutely.
So I would want to see a day when Nigeria would prioritize health as a development concern, and when they will back up budget with capital, so that we don't have a lull. You cannot afford a gap in healthcare until we get there and take it very seriously.
We keep pushing.
But thank God for health insurance. We need to mention that here.
Yeah,
it's important. we need to amplify, more takers of health insurance, and knowledge, education, knowledge, information. They must go for anybody who is serious about healthcare. And thank you, Health Watch.
Thank you so much. It's been a pleasure hosting you at the Nigeria Health Watch Curated Conversation. And personally, it's been an honor to be able to do this, host Auntie Moji in a curated conversation. Thank you so much.
Thank you very much. I'll come back again.